For many people, springtime is a great time to jumpstart a healthy living mantra and visit the doctor for a checkup. Healthy living is also important if you're living with digestive issues, from Crohn's disease to ulcerative colitis or celiac disease, because you may also have a condition called Iron Deficiency Anemia, or IDA. Here now is Dr. Rye to explain the causes of IDA and ways to manage it with your healthcare provider. Doctor, what is IDA?
Thank you for having me, Deb. IDA stands for Iron Deficiency Anemia, which refers to a deficiency in the amount of iron in the body, which is important to produce hemoglobin, which is a protein in red cells that carries oxygen throughout your body. So if you don't have enough iron, you essentially don't have enough oxygen in your body, and it essentially leads to fatigue and some other problems, which we'll discuss in more detail. But it is a very common nutritional deficiency. In fact, we think about 25% of the world's population might be affected. In the United States, it's about 5 million people we think have iron deficiency anemia.
Does IDA disproportionately affect certain patient populations?
Yes, it does. So we find it is a little bit more common in women, especially when they're in the childbearing age. It appears to be as common as 1 out of every 5 women. And then there are certain GI disorders, anything that prevents the absorption of iron in the body, chronic conditions such as Crohn's, colitis, celiac disease. There are also people with chronic kidney disease, any type of cancer. One of the common things we're seeing now is with weight loss or bariatric surgery. These folks can be very much prone to iron deficiency anemia as well. And vegetarians and vegans, which are not getting enough iron in their diet, can also be at risk.
Doctor, can you tell us what the symptoms are?
Yeah, they can be very subtle, Deb. So for example, it could be a young, healthy, college-age kid who all of a sudden becomes, a little bit short of breath when she's out on a run, or a little fatigued when she's studying. Or it could be somebody in their 30s and 40s who is suddenly developing shortness of breath with their routine tasks, going up and down a flight of stairs. Or it could be very subtle, for example, a little bit of hair loss, brittle nails. It could be pica, which is this craving for ice. In older people, it can be much more serious, so it could lead to them being lightheaded or dizzy, having chest pain, palpitations, and very severe short of breath where they could end up needing care in an emergency room, needing blood transfusions, things like that.
How is the patient tested for IDA?
So I'm trying today to raise awareness about iron deficiency on behalf of Daiichi Sankyo. There are some wonderful ways, you can have a conversation with your doctor. The first step is to just tell them about your symptoms. The testing is actually fairly straightforward and simple. It's a complete blood count that measures the hemoglobin levels, and then there are some iron profile tests that can be done that include things like ferritin and transferrin saturation.
How is IDA treated?
Again, it needs to be individualized with the healthcare provider, so we encourage your viewers and listeners to check in with their physicians. But it starts with a healthy diet. And then there are some over-the-counter iron supplements. The problem sometimes that we see with iron supplements is that they start taking these supplements and they may develop a GI distress. They may develop some nausea, stomach upset, or constipation, and then it creates a problem with compliance. They stop taking these medications. So now there are some newer, better intravenous or parenteral forms of iron that are available that you can go into your doctor's office. It could be an outpatient infusion. 100% of the iron goes into the body. It can be corrected within a week or so. It's a 30-minute infusion or less. So there are some newer, wonderful ways to fix the iron deficiency quickly.
Dr. Rye, is there anything you'd like to add about IDA?
I wanted to encourage your viewers and listeners to take this opportunity. It's springtime to kickstart their health. Go in and be tested. And if there is a problem, hopefully get it corrected quickly.
I'd like to thank you for taking the time today to talk with us. Have a good day.
Thank you so much for having me, Deb.